So good to hear from you this morning, or to see you. Today our feature is going to be with Doug Thompson. Doug is a dentist. He founded the Wellness Dentistry Network and has done a lot of work in terms of preparation for dentists for getting back to work in the age of COVID. If there's any group that has gotten nailed badly with COVID-19, it's the dental group. Before we move further, I have an announcement and some personal news, and maybe giving myself up a little bit. I actually was able to get that darn pulse oximeter to work. Pulse 66 and O2 sat 99. Now, those of you who have followed a couple of these may remember I couldn't get it to work at all the first week. Then I found out that I had one of the batteries in backwards. Still couldn't get it to work. I got the lights to come on. After the second week, I finally got it to work, and you can imagine what was going on. I was refusing to read all these directions. Finally, after reading the directions, I was able to get it to work. Janice, my wife, would say, "Yep, Ford, you're just a man." Those of you who were around and remember navigating prior to the age of cell phones may remember that some guys would just continue to drive rather than stop and ask directions. I was one of those guys. So I finally got it up and working, and yes, it helps to read the directions. So very quickly, upcoming topics, previous topics, and we'll get to Doug's topic today on how you can look and see and ask questions and find out, is your dentist actually being safe in the age of COVID? And if your dentist is being safe, then he or she is protecting you. Upcoming topics: mutant, more contagious coronavirus. That's from the Los Alamos labs. Coronavirus circulating long before it was identified. Yes, that's not uncommon at all. Can herd immunity for pandemics? Can herd immunity be achieved without vaccines? Yes, of course it can, but the real question is, can we as a society take the number of deaths that's going to result in? That's going to be Thursday, I believe, on Facebook Live. So Carl and I have been doing a little bit of work with Michelle on getting a little bit of Facebook access to those folks that are Facebook committed folks. Previous topics: fewer people are doing social distancing even before the states open up. Privacy issues associated with contact tracing apps, inaccurate death certificates. It was bad before COVID-19, and COVID-19 is just making it worse. COVID-19 condition emerging in children. We're seeing more of that. There was an update article on that with kids in New York, more of what's called a Kawasaki's disease. It's an inflammatory disease. Again, that's more the exception than the rule. Kids are relatively safe with this virus, much more so than compared to those of us in the baby boomer generation with chronic diseases. Most of them, not all, coming from prediabetes. Mysterious blood clotting complications, young, otherwise healthy people having strokes associated with COVID-19, not just mini strokes, not minor strokes, but major strokes. And then pulse ox, what my own little news on that. Remdesivir, The only drug so far that's that stood the test of time and testing in terms of clinical trials, about a 30% improvement in length of stay in the hospital and in death rate. As I've mentioned before, we have routine care available for folks, for those of you who are struggling to get access to your doc. The biggest thing, I think, the most important thing for all of us is to know whether or not we've got this underlying disease, this underlying prediabetes. 90% of us that have this don't know it. And that is what is sneaking up behind us, killing us, inflaming our arteries, burning our artery walls, causing plaque. And again, the vast majority of us have no clue. So again, if you'd like to find out if you have that, we've got some services, very affordable, to help you get there. CIMT webinar. If you, let's say you got your IMT, a lot of dentists have been doing these over the past few years. You might have gotten one with Doug at one of his programs, one with David Meintz, one with Tide. Sometimes you may not have access to a doc who knows how to interpret these. We're making that available as well by webinar, very inexpensively. And again, we will keep you posted on the book. I sent Todd a text this morning, haven't heard back from him yet. We will get to Doug and his topic on how to make sure that your dentist is protecting you right after the water ball. So just as a reintroduction to Dr. Thompson, Doug Thompson is a dentist. He founded the Wellness Dentistry Network. He works at his own shop in Detroit, one of the major early epicenters for COVID-19. He also is senior staff at the Coy Center, a world-renowned, high-quality program in Seattle for training other dentists throughout the world on different aspects of dentistry. Doug's focus from day one has been what happens in the mouth and its relationship to what happens in the rest of the body. So given his perspective, that's why and how he founded the Wellness Dentistry Network. When you go see a dentist, you may want to check and make sure that those dentists or your dentist at least has knowledge of it, because otherwise you get what we call a drill, fill, and bill kind of dentist. And what I mean by that is this. Most dentists, like most docs, come out of school and get very excited about maybe taking care of the patient's overall health. Then they run into some challenges and they just forget about the patient's overall health and just start trudging through the day. For a dentist, that means, gosh, half of them, depending on the practice, depending on your practice, on their practice, maybe up to half, sometimes with some dentists, even more. Half or more of the adults coming in having bleeding gums. Now, what does that mean? Bleeding gums is very much associated with inflammation, cardiovascular inflammation, and therefore a risk for heart attack and stroke. If you go into the science, we've known about that. Everybody in the most people in the medical area, even the CDC's made comments about that in the past. They never knew, or they seem to get hung up on the question of does bleeding gums cause cardiovascular risk and inflammation, or is it vice versa? And our mutual friends, Brad Bale, David Vigorous, Amy Doneen recently published an article. I say recently, it's about 2 years ago, indicating that I think some of the first solid evidence that this really is what we suspected, those of us who do this, it's bidirectional. Problems with gums, infections in gums creates an area for bacteria to get in, and these bacteria are what we call inflammogenic. They do cause cardiovascular inflammation. Speaking of inflammation, there's a lot of information coming up about inflammation and COVID-19. Inflammation that, in many cases, like for example, we'll be showing some clips from an ER doc's video, which was meant mostly for other ER docs, talking about the real difference between what we call the happy hypoxic, people that have coronavirus infection, but really don't go south, really don't have bad COVID-19, lethal COVID-19 versus the others. And the difference appears to be our old nemesis, inflammation. You start looking at our markers that we've heard of already. C-reactive protein. One of them's looking at IL-6, interleukin 6. We've seen that several times in other videos. So again, a lot of focus and understanding around the mouth for Doug's work and inflammation. So Doug, I'm going to step back for a minute and let you get started with what you do.
Yeah, thanks so much, Ford. The slide is the courtesy of the Coy Center. I was part of a 10-person task force to help guide dentists as to best practices policies when they come back to work. So that's where this title slides come from. So this few of these slides that I have are from that presentation, and they're designed for dentists, but your viewers are super sophisticated and they'll get the idea. So I just want to share some of those brief comments. So one of the things that we know for sure, if we look at all these little bubbles on the screen, these are bubbles that represent different occupations and their risk. And if you look up in the very upper right, you'll see that dentists have a high exposure potential. And that's due to the aerosols and the way we work in the office. Obviously, saliva can hold a lot of these viral pieces, and we not only manipulate the saliva, but we aerosolize it, through our instrumentation. So this is what the concept is about who's at risk. And so we really need to think about what we're doing, not only to keep our teams safe, but keep our patients safe as well. And on the next slide.
Before you go to that slide, Doug, I'll share with you. I've shared with our viewers that about half of my work right now is working with large employers, helping folks get back to work. Mm-hmm. So again, getting very eyeball deep into this whole issue. And as I've said to our viewers multiple times, dentists are right at the tip of the spear of this issue. And if they're at the tip of the spear, be careful about going to a dentist. And I don't know if you feel comfortable sharing some of the things that you're hearing
the different states all have different rules on when we can start, and some started as much as a week ago. We're still shut down here in Michigan until potentially June 1st, maybe later. But last week I had a couple patients call my office for new patient exams, and I said, I'm sorry, I can't do that. We can only really treat life-threatening emergencies right now. That's the idea. And there was a little gray zone onto what's an emergency and what's not an emergency. However, when I declined to treat the patients or to be able to see the patients, they said, that's why I want you to be my dentist, because my current dentist says no big deal. We're doing a few things, but they're not really doing some of the necessary things that we think might keep everybody most safe. So I'm not here to pass judgment on on what the dentists do or how they do it, but I just do want to share with your listeners a couple things they might look out for when they do go back to their dentist.
I agree. And this has become a huge political football too, this whole return thing. But again, folks watching this channel tend to, as you said, be a very sophisticated crowd. So,
but you realize too, Ford, from dentistry, we get paid for doing. Right. We don't get paid for diagnosing. We get paid for doing. So our businesses are there's some dentists that are not going to survive. Right. So it's really, really rough on the dental people.
And for a reminder for the viewers, I know you know this because of what you and I've done together. given what I do, I'm very, I have more exposure to the dental community than the vast majority of docs because of dentists like your group, the Wellness Dentistry Networks, the fact that there's such an association between oral inflammation and cardiovascular inflammation. Your guys know and understand this.
Well, we're going to make this a positive because we're going to figure out how to be better, and we're going to figure out how to deal with these things in a much better way, and we'll all be safer because of it. Ultimately, we just have to weather the storm. So what this slide shows is very graphically easy to understand. And Ford, you've covered it very well with the face mask idea and social distancing. But these droplets travel around, whether it's a sneeze or a cough or whatever it is. These droplets not only travel around, but they hang around in the air if they're small enough. And I don't know if you've gotten into the difference between an aerosol and a droplet, but it has to do with the size of the molecule. And some of these things hang around in the air. So we have to do something to manage this aerosol. And so on the next slide, Ford, I think is a concept about how long, if this aerosol lands in the operatory, and I know, Ford, you've gone over this, and I know you've done programs on how to clean your groceries and, what to do if you go out to stores and stuff. And this is basically a graphic that we share with dentists to let them know how long this virus hangs around on certain surfaces. And Ford, as you look at the time there, do you have any major, are you aligned with some of these times that these viruses hang around when they land on surfaces?
Yeah, I am. Again, the CDC started that fairly early. I think it was CDC with the first report on what they were seeing in the Diamond Princess after that. And then a lot of stuff has come out since then. Most of it's confirmatory, and most of it's consistent with what you've got here.
And this is sourced from the CDC. Yeah. Okay, so for the next, on our next slide, these are the things we do in practice. We have ultrasonic instruments to help clean the teeth. We have high-speed handpieces to shape teeth when we're drilling and grinding. And then we have that neat little air-water syringe that we use to blast air and water for rinsing. But that all creates aerosol. And so this is to remind our dental people that these are the devices that create aerosol. And sometimes our hygienists haven't been thinking about it quite this way, because normally the high volume evacuators are these big, serious suckers that we have to take care of the stuff chairside. They've been in the dentist's hands, not so much in the hygienist's hands. And now we're starting to equip our hygiene operatories for those kinds of things so they can manage this overspray as well. And so this is an actual picture of Dr. Dean Coy's office. He actually had a piece of plastic catch on fire in the office. And if you've ever seen plastic burn, it makes that little tiny, tiny fine particulate smoke. And that particulate smoke got into the heating system. And this just gives you an idea of how these things land in offices far away from the source. And this is the idea with these aerosols. We're not really sure if diseases can be contracted from these aerosols. But I guess, Ford, we have maybe Legionnaire's disease, right? We know that comes through the air. And so we're just not sure yet. There's no science that shows that it can be, but we need to, hopefully the dentists are doing something to think and consider about managing the ambient air. That's the idea.
This is a very telling picture, and I agree with you. The science on showing, well, this came from that kind of aerosol is a little bit thin right now, but given the infectious nature of it, given that R0, whether you think it's 2 or 4 or whatever, those are R0s that are reproductive index, measure of contagiousness. I think that in and of itself, and what's happened with the pandemic in and of itself, tends to speak for itself that there's a very good likelihood that this is transmitted that way. Mm-hmm. It's going to be a while before you see the science prove one way or another.
Yeah. And then this is just a graphic. If you focus on the blue area, this is just a graphic where the droplet spreads in the splatter zone. It's up to a couple meters. I mean, if you think about it, it's a long ways, and we typically don't think about it. So not only do we want to be protected, but we want to have some kind of protection for our teams and our patient, and then be aware that that area that we're working on is potentially contaminated. It would help us to know if we knew the patient we were working on, had COVID or not. So we have some pretty intense screening. And I think on the next slides coming up, you'll see, this is the piece about air scrubbers. And the only thing we'll show about the air scrubbing, but what we can show on these air scrubbers is if someone's going to put an air purifier or an air scrubber in the office, there's several different components of filtration. And on the next slide for it, I think there's a HEPA filter. But these air scrubbers have either HEPA filtration, charcoal, UV light. They'll have some oxidative filtration, and some will even have ozone that helps. They pack these pieces all together in one big filter. And there's companies like, I don't make any company endorsements, but the name of the company would say it all. It's called Surgically Clean Air. There's many of these different companies out there making these filters or these types of filters. So if you go into your office and you say, "Hey doc, what are you doing for your ambient air?" and they go, "Well, we got some surgically clean air scrubbers." This is what they're referring to. It's this kind of HEPA filtration, and it could be charcoal, and it could be UV light, many different variations of these things. But what it's doing is it's taking virus particles out of the air and scrubbing the air. And there's so many air changes per hour that we would want to do to keep the office disinfected.
Just a quick comment and question about that. As I mentioned, I've been talking with a lot of dentists, both as part of my return to work activities and part of my connections with the dental community. I've heard a lot of guys say, "Well, that's just cost prohibitive. It's too much hassle. I'm not going to do that. I'm not going to be doing positive pressure stuff." I remember talking with you about that. What are your thoughts?
Well, the negative pressure rooms are a big stretch because it creates quite a bit of re-engineering of your existing space. And we're really hopeful that we don't need to do that. And we think that through these other precautions, great chairside aerosol management, ambient air scrubbing, proper personal protection equipment, knowing quite a bit about your patient before they come in through enhanced screening, our temperature and our pulse oximetry. We're hoping that that's going to be enough to keep us relatively safe. But we are not set up for it like hospitals that have ER room, that have surgical suites with negative pressure, nothing on the counters. That's not how our practices are set up. So we are in a little bit of a discovery zone for what's going to happen.
So in your discussions with dentists, how about these scrubbers?
I think there's things that are mandatory, highly recommended, and maybe suggested. And I think these maybe are highly recommended, but they're not going to be mandatory. At least we don't, as of yet. The CDC and the Dental Association, the American Dental Association, haven't made these things mandatory. So we're really lockstep in what they come up with as their final guidelines, and then we'll have to make good clinical judgment. I happen to have 2 of these air scrubbers on order for my practice, and I think it gives me some security, and it helps give my patients some security that we're doing more. What we're doing in our practice is going to be above and beyond. And most of our COIS docs, if you needed a doc in your environment and you looked up a doc that was educated at the COIS Center in Seattle, KOIS, these docs are well aware, and these docs are probably going to the extra length to, the extra mile to make their offices safe and their work environment safe. I mean, I'm in there 8 hours a day. It's not just for my patients. I mean, I want to be safe too.
Well, that actually brings me back to a disconnect. I mentioned positive pressure. I was talking about
negative pressure.
No, negative pressure is for the room. Positive pressure is for the personal protective, and it's the moon suit.
I get you. Yes.
Anybody discussing that yet?
Yes. As a matter of fact, in I think one of the provinces in Canada, it's either recommended or it's highly suggested. But yes, that's those are being considered, and you might see some people wearing those.
So let me actually, for the viewers, let me just clarify. So negative pressure, Doug's talking about the room, having an area in the room to suck the air out. And the positive pressure that I'm discussing is having, again, people call it a moon suit. It's where you actually have an air supply to the dentist, to the healthcare workers, and that air has positive pressure push. So the mechanics is to push that the infectious agent out of the breathing space of the healthcare worker who's actually using it. So the negative pressure is a room protection component, and the positive pressure is a personal protective component.
Yeah, and I already know, Ford, one of the questions is going to be, well, how big are these coronaviruses? And it's anywhere from 0.1 to 0.3. So these enhanced filtration systems should be capable of doing that, but we've never had a coronavirus before like this that we're evaluating. So we'll have to see how it goes. And then Ford, did you do anything with your group on hypochlorous acid? But this is the HOCl.
I've just mentioned it a couple of times. As you know, it's a big deal for environmental cleanup. And the other branch, the group that I work with is called Open Health Advisors. We've been doing some, like I said, we've been working with some employers. We've also been working, I have been doing more of the return to work components. David Vigorist, who you know, a Vanderbilt trained and faculty level virologist and lab scientist, has been involved in this part of the piece. We've had several programs, one of which was with a major pharma manufacturer. And in terms of financial costs, these guys lose millions per day if they shut down. Hypochlorous acid has been a big deal for them. And I'll just remind you, you and I had some of this discussion because David has been getting it on more of a industrial, major components. And I remember you and I talking about just right there in the dentist's office, you have some ways that you can make it and use it.
Yeah, and this is a homemaker. That's why I really brought this out for your viewers. This is a great way if you're concerned about disinfecting your produce and disinfecting different things in the house. You can buy this little maker and you can make it. You can make a half liter or a liter a day and put it in a spray bottle, and you can use it for a lot of great things. So we're actually going to be using HOCl in some fogging systems. And we'll be fogging the office at night after our patient treatment. We'll be going through and fogging the office, and it's really harmless to your upholstery and your different things in the office. So it's really safe to use. And on the next slide, you see there's two simple ingredients. You basically need tap water, some electricity, some salt, and a little bit of vinegar. And there's instructions from the company on how to make it. But it's really easy. It's an easy product to make. And what you end up doing through driving electricity into the water, you split the chlorine atom off, and so you get a little bit of free chlorine in the solution, and it's very disinfecting. And this, as you know, it's a pretty weak virus, so it's pretty easy to use something like this. So there's a lot of dentists that have never heard of or even used HOCl before that'll be using HOCl in some way, shape, or form.
Yeah, I will. Just for those of you, the viewers that are curious or geeks. Basically, you may be recognizing HCl, hydrochloric acid. It's not exactly hydrochloric acid because of what Doug was talking about. It's that oxygen atom in the middle of it. It's not a pure molecule. There's just one atom out of the molecule. So that's where you get into some of the electrical components of splitting up that oxygen and getting it to bind to that HOCl. That's the difference between hydrochloric acid and hypochlorous
acid. Yep. Right.
Right.
So real simple to make, and we are going to be making that. And then, of course, when you walk into your office, you're going to see different masks. You used to see the one on the right. You're probably going to see dentists wearing some variation of these masks. That's the idea. And for our aerosol procedures, we're recommending the N95 or the KN95 mask. If we know our patients don't have COVID, in other words, if there's tests, we might be more comfortable to be able to go back to a level 3 mask, but that would only come if we know we have testing, and we can talk about that after, how we could test asymptomatic patients or patients that are coming in for evaluation or for long appointments. And then shields, same thing. Shields, our concern for it is we need these shields that fit over loops. because we wear magnification when we work. So you might see visors and shields worn more by your staff. And this is belts and suspenders. As long as you have adequate eye protection, you don't necessarily need a shield, but it's recommended. So it's not mandatory, but it's not a bad idea. And then the gowns. Our gowns are going to be more disposable gowns. So we're going to look a little bit more like hospital workers than we did. I used to work in a shirt and tie with a clinic coat on, and those days will probably be gone for me. I'll have to have something more protective over the clinic coat. And then our temperature and pulse ox. And I know, Ford, you've done a bunch on this, but this will be routine at your office. People will be taking temperatures and pulse ox. Our next slide shows a pulse ox, but I know you know this temperature thing very well because, Ford, I've been on your on the YouTube watching you discuss taking temperatures, and so we're using 100.4 as a cut point. And sometime, Ford, it would be nice for us to do something talking about the difference between normal conditions where people might have an elevated temperature and what a real symptom of COVID is. I think there's going to be a little bit of confusion for us about that. So I know if there's an elevated temperature, then we got to do a little bit more, figure out a little bit more.
Yeah, it's a good point. And again, it's a major question that's come up for employers. And I will tell you, most of them are taking the high road and saying, okay, if someone has 100.2 or 100.4, whatever the cut point we end up with, they can't, most of them are saying, you can't come back to work until you've been cleared by a physician. So just making it easier to make that choice on the HR side, human resources side.
And then what's up with your channel, Ford? I'm looking at the chat box, and you guys are all taking pulse ox and comparing it to each other this morning already. So, so about this. Everybody has one, it seems like, on this channel.
Everybody but me until this morning when I was doodling around with it. I should have just the instructions.
Well, the whole idea is, we have a patient come in and they say they feel fine and their pulse ox is down in the low 90s. We know they got a problem. So we would, this could be a real early, this could be a really helpful early discovery thing. And so, and I'm listening to you, Ford, too, learning about how to identify these people earlier and earlier. So as we start to close this piece about how your dental office is going to look different, I do want to get to and mention just testing. And yes, we do have a saliva test. I think you might have heard it. You might have announced it even last week. Rutgers, Oral DNA, Microgen DX. There's a few companies that have this. And I will be doing some pre-operative testing for my patients. I will be doing testing on my staff, only because, I can't guarantee it's a COVID-free office, but I can really lower the risk. And so for those that will spend the money, these tests are about $125 to up to $200, depending upon how you get it and where you get it from. But they're highly accurate and they're reliable. And I know that, if somebody tested on Monday and I was seeing them on Wednesday, I'd feel a lot more comfortable about how I dress and what I have to do. And that's the idea. And these tests on the next slide just show that they're just simple swish and spit tests. It's really easy. It's a 30-second swish, spit in a cup. And this nasal swab piece to this particular test, this is the oral DNA test, the one that I use. This is not that swab that goes back into the nasal pharynx. It's just a little bit in the, 1 inch in the nares. So it's a very easy swab and a very easy test. And within 24 hours, I can 24 hours of the time the company gets it, I can have the test results. So it'll be really reassuring for me on my long patients, people that I'm spending the afternoon. If you're someone out there that needs a lot of dentistry or scaling and root planing or one of these procedures, it might be nice for you to know.
So just as a reminder or a clarification, this is another PCR.
This is a PCR test for active COVID. This is not an antibody test, and it is not a blood test.
It's it's like the test that you get with the swab.
Yes, but it's saliva, and then this is just a test report. It's simply yes or no. And if we had somebody that tested positive, we would take more steps to further diagnose and get them help. All right, and then a pre-procedural rinse is the last thing. As we start to close this piece forward, a pre-procedural rinse you might be asked to do as well. And these are some type of disinfectants, either sodium hypochlorite, molecular iodine, hydrogen peroxide. Your dentist is probably going to feel more comfortable if you do a pre-procedural rinse, and it just cuts down the population of bugs in the mouth before we sit down and start working. That's the idea. And these rinses are usually going to be for about a minute. And then as we work near the mouth, you'll see more devices that you haven't seen before. These are all little intraoral devices that stick in the mouth in some way, shape, or form. And the only thing I'm going to share with you is if you're used to getting your teeth cleaned without any of these things, just be prepared that one of these things might be suggested to be used. And again, it's for your protection and for the protection of the people that are working. So this is a way to manage the aerosols. And then this is what everybody's on everybody's mind. I have people calling me regularly. Hey, I want to get my teeth cleaned. I'm behind. I have gum disease. How long can I go? And I really would think about, I divide all my patients up into healthy patients that really don't have a gum disease issue. And then if you're a patient that's in some form of gum disease management, or that's somebody who needs more routine care because they have a susceptibility. And of course, for the inflammation management piece is critical. And this color wheel, I think I've shared this slide with your audience before, but this is showing how oral inflammation is tied to 57 other diseases, or referenced with 57 other diseases. So the reality is I don't want the inflammation on our patient population that has gum disease going crazy. So you can enhance your rinse systems. There's different things you can do even now in the downtime to do better. And we could talk about that, after. So that's the idea behind this, is not everybody is going to suffer from missing a dental appointment. But some people they're going to feel the effects, and they're going to have some, it's going to be a little bit harder getting them stabilized going back. Right. And then Ford, this is you, right? While preparing our immune system to meet the virus, we're just, in a simple way, just letting people know that dentists are aware, and we are coaching our patients to, make sure we have optimized vitamin D, and we have vitamin C, and that we eat a healthy diet. And I don't even need to share this with this channel, because Ford, you've talked about lifestyle, and the work Janice does in nutrition coaching and the lifestyle management is critical to help us just be prepared I call this kind of preparing your patients to meet the virus, right? And if you're going to meet it, you want to at least be healthy before you meet it. That's the idea. And then these are the other lifestyle factors again. And we remind our patients that it's obesity, diabetes, and hypertension. And Ford, you've helped us develop the blood pressure record. You've helped us develop the finger stick record that we encourage our patients to do for a couple weeks when with a freestyle light. We have some patients that are wearing CGMs, continuous glucose monitors. So it's really, really a privilege, Ford, and I thank you for your mentoring and in helping dentists understand these lifestyle issues that help people be healthier.
Well, thank you.
So that's kind of all I have about, just going to give you a little snippet of what this might look like going back, and what dentists might be doing and what you can expect.
Well, that was very helpful, Doug. So what we'll do, if possible, Aspen, if you'll give us the little Q&A spin, so we folks know that we're going into Q&A. So, Robert Simpson, good morning. James Cantor, PO2 of 99% is good. Yes, it is. Joe Riley's got 97% and 67 beats per minute. My BJJ, good morning from Temecula, California. Thank you so much for these daily podcasts, Dr. Brewer. They've been of great value to me and my family. Well, thank you, Chuck. We appreciate the acknowledgement and the interest, and we'd love to have a contribution. And if that's not working for you, don't contribute if your income is taking a major hit right now and having challenges because of COVID-19. But if you would share these, put it on social media, that makes a big, big difference in terms of getting that channel out. Thank you again for your interest. James Cantor, Joe Riley's at 97.7. Same as mine. As you mentioned, Doug, we got a lot of folks checking their O2. Now, the real issue is, here's where that comes in. If you get COVID-19, or if you get an upper respiratory or flu-like syndrome, that's when to start looking, because that's the thing. This bug sneaks up on you in terms of getting you very hypoxic. Folks can get very hypoxic and go down the tubes. We'll talk about that next week. You have what we call the happy hypoxic, and then the inflamed hypoxic. And again, once you start getting significantly below the mid-90s in terms of your percent O2 or your O2 saturation, and you're normally like a Joe or myself or James in 98, 99, you need to let your doc know that.
And we're using 92 for it as our cut point, for awareness.
And the kind of numbers that you're seeing in the ER, for example, are in the 60s and even 50s. People coming in, they're in their 60s, and they're working on their cell phone. It's just unusual. We haven't seen that before. That's not been what we tend to see. Anti-FB League founder. Not sure what that meant, Joe. Jan H, are people with controlled high blood pressure and controlled type 2 diabetes still in the, thank you, Aspen, for showing the, are they still in the comorbid categories for COVID-19 complications? Yes, they are. Now, you bring up an excellent question. How much does proper management mitigate the problem and decrease your risk for COVID-19? In other words, the serious disease if you get the infection. And I think most of us are assuming that it helps a lot. I think we also need to assume that it's not getting us away from risk completely. Looks like we've had a super chat, $5. Joe Riley, thank you so much. Super chat for super docs. Thank you again, Joe. Appreciate that. Obviously, Doug's not getting paid for this time, and I don't either. But we do feel strongly about getting that information out. And when folks like yourselves contribute, it makes a big difference for us in terms of our attitude, and it makes a big difference for us financially too. Joe Tocho, I usually get my teeth cleaned 3 times per year, and right now I've skipped one and coming up on my second normal appointment slot. In Minnesota, we still cannot go to our doctor or dentist. Any comments from our expert?
Yeah, so what I would say to John is if it's been recommended to him to come in more than twice a year, then there must be some inflammatory issue, or he must have a increased susceptibility to disease. So he is someone that would require more professional maintenance, which is that mechanical debridement, or removing that bacteria, yeast, and viruses from around the gums. So hopefully, John, your dentist, is taking you will give you a little bit more priority to the healthy person that maybe can afford to skip, because it's a little bit harder for you. So your dentist will be back soon. I'm sure it'll be within 3 weeks, probably. I would think, and hopefully they're safe and you're safe, and you should have comfort going in. Now, they might not use the same instruments that they used to use on you and for you until we get it all figured out, but that's okay. At least you'll get some maintenance around the teeth.
Doug, I'd like to use this as a segue to talk about the dentistry program that you've set up. I've been pushing you to offer services to folks who aren't in Detroit, and you've actually done that for a couple of my patients.
I have.
Dentistry program, and it's been a big deal. They both were very, very complimentary and excited about the service you provide. Could you describe a little bit more about that?
Yeah, I thought that I was wondering when this whole thing started, and it kind of pushed me forward. I was wondering, is there something I could do remotely from home to help people? And so we created the homedentalexam.com. And on homedentalegam.com, it's not typically a place that a consumer would just go and stumble over that website and then order up a test. Usually somebody's recommending they get a certain test or something like that. So I thought if I could find out the bacterial load in somebody's mouth, like John, for instance, how much bacteria is there, and if there were a lot of really aggressive bacteria there that would affect your heart, diabetes, and your gum health, maybe I could help him do better while he's in this off time. Now, I'm not trying to step on any dentist's toes. I'm really trying to assist people to get some information about what they can do during this time, and then to collaborate with their dentist to make their care better if they do have a problem. So homedentalegam.com and I appreciate you mentioning it, is where that is. And it is, I do feel better. I think after I've spoken with a few people, I think they feel better about where they are. And I think it's a nice thing to do. And this is how I'm going to distribute my active COVID testing as well.
So Aspen, if you could, are you able to share my screen again? I have homedentalegam.com brought up.
Oh, you have it up. Okay.
I don't know if you can see it yet, or not, Doug.
I can see it. Yeah. And as you scroll down forward, you'll see the different tests that are available. They're at the bottom. They're listed. Yeah, this is where the tests are available. And so you can, most of these tests are from the Oral DNA company. That's who I work with. And if somebody wants to have one of these tests, and they can do it right. They can order it right online. And then, for a couple extra bucks, I can do a review with them and share with them what the, an interpretation guide, if you will. But it's helping people learn, because actually dentistry isn't really here yet, but we're in an era where, depending upon the bacteria that you have in your mouth for it, it's going to make a difference how your ongoing care in the future is, whether you have gum disease or not. I mean, if you have a bunch of bad acting bacteria, right? Amy and Brad's paper showed us that even the presence of those bacteria at high numbers are influencing your vascular system. And any of our patients that might get exposed to this virus, the last thing you want is more vascular inflammation.
Yep. So, I appreciate you sharing that. I appreciate you going ahead and doing that work. As we've discussed many times, I was fairly early on the medical side to get into remote access. With COVID, now everybody's finally getting there, at least in terms of the doctor's side. I will tell you, I think I'm interested to see how this happens with the dental community.
Well, Ford, I've learned a lot from you about how to try to help people get educated. And telehealth. There's a question coming up about telehealth, and yes, we can do that. But I'll tell you, it's exhausting. Talking on the phone and trying to really guide somebody over the phone is not as easy as I thought it might be. And so we really had to figure out how to make that go. So I want to do more educational video pieces, short pieces where I can help people learn, because it's hard on the phone.
Education is hard work, but as we know, you can't medicate, you can't procedurize, you can't stent, you can't supplement your way out of a bad lifestyle. So no matter what we do as healthcare providers, that is second and third and fourth place compared to the first place of lifestyle. And that's not going to happen unless the patient knows what they need to do.
Yeah, and that's why I need access even to your material for our patients, because the patients just aren't totally ready they're very welcoming to have dentists talk to them about whole health issues, but it's not typically the forum where they hear that. So it's still, we're still adjusting to that.
So this is from Erland. My wife, 75, has receding gums, gets deep cleaning 4 times a year. Can she go without the dentist for a year?
Yeah, this is an easy question. This is a no. We really shouldn't take a year off, because things can get really out of control. And at 75 years old, that's another risk factor for more advancing disease. And we just don't want anybody to go that long without some preventional intervention. Now, to what you mentioned, Ford, even on homedentalexam.com, I have an exam kit on there where I send patients some cheek retractors, and they can actually, like a game you play, and they can actually take some pictures with their iPhone. And even getting a visual look at the teeth, I mean, there's quite a few things I can tell, and there's quite a few things we could do to help people. So there's two questions to Erlen's question is. She shouldn't go a year, but there are maybe some things you could do, and maybe her current dentist might entertain a phone call and a video chat to help her to make sure she's not getting unstable.
I agree with your point, and I'm going to poach into your area some. I had my own bleeding. I had my own bleeding every time I went to the dentist until I began to work in this community and realize what that meant, because I never had a dentist tell me that that was a problem.
Yeah.
And so after finding out that it was, I became much more, I always thought that I was fairly good at flossing, and I was compared to most folks. But I think that, again, many of us depend too much on the dentist and the hygienist and forget about what we need to be doing in terms of our own hygiene. Any comments about that?
Yeah, there's so many things out there to do. So even in our virtual world, we've networked with a virtual hygienist, and really for the cost of a cleaning, well, maybe for a cleaning appointment and a half, we've created a lifetime access to a virtual hygienist. There are so many little picks and tools and things that we can use that it's impossible for me to sit with a patient and figure out exactly what's going to work best in their life. So for those that want a subscription to a virtual hygienist for life, it's a one-time fee, and they can a couple $100, and they can have a virtual hygienist. And the dynamics of the hygiene principles change, but she goes through irrigation and water picking and different things in the irrigator and pH balance. I mean, it's quite a nice platform of information, but we want to leverage that virtual teaching, and people can learn that stuff. But there's a lot out there for how to clean in between the teeth and how to clean the tops of the teeth.
I tell you what, on a personal basis, I went from having bleeding just about every time I remembered ever going to the dentist to not having any at all since then. Now, it took a lot of work, and just to talk about our culture and some of the things wrong with our culture, as you know, up until my last retirement about 2 years ago, I was traveling a lot, as in 90% of the time, working with dentists, even folks that would hang around with you, more of a wellness dentistry type person. Mm-hmm. But after dinner, when I'd whip out one of these and start picking out the stuff between my teeth, I'd get these funny looks. And you know why. I mean, that's just not within our culture. Right. It took like at least 3 or 4 episodes per day with this thing to start getting that inflammation out of my gums. Yeah. And people just don't think along those terms. No. Even folks that focus on inflammation, they tend to be more passive and think, well, I'm just going to leave it for the hygienist 4 times a year. I mean, I can tell from reviewing your science and your literature that just doesn't cut it.
No, you have to do something daily at home, and you have to do something in between the teeth and something on the tops of the teeth. Now, I do have that odd patient for it. I mean, it's an odd patient that doesn't do hardly anything to their teeth, and they haven't done anything for 30 years. I had one person, hadn't been into a dentist for 30 years, 0 disease when he came in. Now, he had a lot of stuff on his teeth, but no disease. So it really hits home for me about susceptibility. And if you're that person that's susceptible to the bacteria, then you're in trouble. But if you're not, then maybe it's not so big of a deal. But that's only 10% of the population. So it's a very small number. Most of us need to manage that on a daily basis at home. And that's why these articles come out and tell you reduce your risk of a heart attack or a stroke by flossing. Yeah. Flossing actually isn't the best way to get stuff out from in between the teeth. But it's a way.
It wasn't for me at all. And people keep saying floss, floss, floss. I got much better results with that.
So did you bring that? Did you bring that for me, or did you bring that because you knew you had to? Because I was coming on, or do you actually carry that thing?
I do carry it. I carry a bunch of them in my pocket.
Yeah, that's great.
And actually, one of my nurses that started working with me after a restaurant, we were walking back to the hotel. She said, "Have you got one of those picks?" And unfortunately, I didn't have any clean ones. So
You don't share your used one. Bacteria are transferable, by the way. Don't share your used one.
I didn't share that one. I started out. Anyway, so Joe Riley's got a question about the micron size. You mentioned that. You want to repeat it?
Yeah, it's just anywhere from 0.1 to 0.3. And these filtration devices, it gets quite sophisticated as to how they trap the virus. But once they trap the virus, they kill it. And so that's how they work. Yes, and again, COVID-19, most dentists, Robert, won't know about. Can dentists order COVID-19 testing for asymptomatic patients? It won't be covered by your health insurance, probably. So it's going to be a cash pay type thing right now. And these rules are ever changing. So yeah. So
is too. I haven't talked to David. This was the first time today, for example, that I heard about the about oral DNA offering it. I had not heard of that yet.
Just last week, yeah.
Dental staff be tested for COVID-19.
Absolutely. I'm going to test my staff probably every 10 days or so, and we'll start opening the practice that those are amenable to be tested, and those that have long procedures. Again, Robert, sometimes I work with somebody for an entire afternoon or an entire day, and I really would love to know. So that's great. This looks like for you, Ford. This is a
BJJ, I'm pre-diabetic, 1 glass of wine with a high carb meal, and my blood glucose stays 85 to 100 postprandial. Am I removing the inflammatory damage from high carb meals by doing this at dinner? You bring up a really good point. Up until now, and even still now, the only way that we can tell, the only way we've been able to answer that question has been to do finger stick blood glucose, and as Doug mentioned, continuous glucose meters. Now, a couple of you, Joe Riley, Tom Tigner, a couple of them have sent me some stuff from a new group. I'm blanking on the name. You may remember it, Doug. There's a new group coming out saying that they've got at home, in the pocket, insulin testing. That's really the missing piece right now. Metabol something.
You know, Ford, I don't think I've seen that. Not insulin testing.
Insulin.
Yeah, no, I haven't seen it. Okay.
And it's obviously it's not ready for prime time. They're testing it, but at that point, my BJJ, once we get where you can actually do insulin testing as well, that will be a huge improvement in the ability to answer your specific question. Are you removing the inflammatory damage if you're keeping that blood sugar under 100? Right now, we have to assume the answer is yes, but we also know from looking at Kraft insulin surveys, I get a couple of patients per month who have really good really good blood glucose numbers when challenged, but their insulin shoots way up, as in way over 100. Insulin in and of itself is at least as inflammatory as glucose, maybe more. Great question. Thank you, BJJ. Robert Simpson, can telehealth be used for dental needs? Well, you know,
no question.
Absolutely. And again, my thanks to you, Doug, for making that available to folks.
Well, thanks, Ford, for helping make it become well known.
So David Ferguson, David reminded me the other day, he said, Doc, you should quit complaining about that switcher technology if you want people to start learning and start getting warmed up to using telemedicine and telehealth. Doug, I know from discussions with you, you know a little bit about that switcher technology. It's like switcher technology's over here. Telemedicine it's fairly simple. I mean, actually, docs and dentists both have been using some telemedicine since the phone was invented. Yeah. You know, you get a communication device and you can start start talking to your
Well,
patient.
and actually, Ford, you bring up just a good point, and I don't want to create the session to be too long, but bring up a good point, because I'm used to consulting with patients on the phone for free. So I'm not used to assessing a charge for that. So that part we haven't gotten to be so comfortable with yet. So I want to make sure that people, we want to make sure that people know when there's a fee and when there's not a fee for that kind of thing.
That's a really good point, and I'm sure folks will want you to clarify that. Now, it's interesting. You're seeing that en masse in the doctor group now, because again, all these docs that didn't do it before are now starting to do it, and they don't know when to charge. And you're seeing a massive change from docs that used to, just have a brief, informal conversation. Now they are steering patients to that. Janice shared that with me. That happened with her recently. But David's got a different question or issue today. What he's saying is, typically HEPA filters use recirculating air. Can the filters collect the virus, become a breeding ground, and recirculate that virus? And are there ways to sterilize the filters, UV, ozone? And again, that's some of the conversation that we had. Doug, you want to clarify that?
And in the surgically clean air system, there's multiple filtration methodologies all packed into one filter, and so nothing comes out the other end alive. So it goes through trapping, charcoal, ionization, radiation, ozone. So this is if you bought the wrong kind of inexpensive filtration devices, there might be some pass through, but not in these surgically clean air scrubbers.
So David, just as an FYI, I was having some of that same conversation with a different dentist, and I was asking him that question about what did he know about the actual efficacy, how efficient these scrubbers were. And it was interesting. Doug had already been down that path, had already studied it, and quoted some numbers for me. So thank you, Doug. And thank you, Joe Riley, for that super chat. We appreciate that very much. Joe, it doesn't look like you're getting a lot of challenges and takers on that today, but we greatly appreciate it. Jan H, is ozonation a possible way to decontaminate operatory services after hours?
Yeah, it is. We don't have a lot of systems currently that do that for us. We have to be careful with how much we do and how we breathe it. We have to do it with people out of the building, but it is an option. It's just a little bit cumbersome right now, and it doesn't seem to be as widely accepted. But there are some people using some of these devices. Again, it's just not so mainstream right now.
David again, Ferguson, do you have any info on what dentists in other countries are doing? South Korea seems to be doing much better in general than the U.S. with respect to COVID-19. Maybe some European countries too. Any comments on that?
Yeah, David, the Wellness Dentistry Network is a global group, and so we have Spain, Italy, Australia. Australia is pretty much back to normal. They're using their ultrasonic instruments now. Spain just went back a couple days ago. I have some pictures of my Spanish friends that are now in new garb, a lot like what we're going to be doing. So we're all going to be within, as we go way, way out in the future, we're all going to look at within a couple months, we've all opened up. And so we are taking cues from them on how things are going and what we're doing. And we'll be doing that. But yes, other countries are starting to open up.
So Doug, to repeat and clarify, the COIS Center is a global group. And
totally.
You've been on this task force for the COIS Center for this activity. So I'm assuming you've had input from other dentists from other countries in this task force.
Absolutely. Yeah. The COIS Center is, again, that webinar that we did last week was almost 3 hours long. We had 3,800 people. It was a really, really a nice conglomeration of information. What we tried to put together, we tried to make it boundaryless, no boundaries, and we wanted the information to be current. And so we did take into consideration other countries, and they have very similar. Everybody's doing the similar thing: ambient air management, personal protection, new patient guidelines, heavy screening, temperature, pulse ox. I mean, these are all very common things that we're going to be doing in the dental practice. And we've eliminated our waiting rooms. Don't be surprised if you pull up in the parking lot and you have to text somebody to get in. The door might be locked. That's how we'll be doing that, because we want to control ingress and egress in the office as well. So, yep.
Good point. Thank you, Hot Wheels 66. Erlen's got a question about, well, how do you recommend self-periodontal care while isolating? Salt rinse, water pick, how often to brush, other recommendations?
Yeah, there's a certain hierarchy of rinses that have more antimicrobial power than others. And you saw a couple bottles on the screen. It's called CTX4 treatment rinse, and that's from the Carry Free company. That's a 0.2% sodium hypochlorite rinse. And our patients that would have the most disease would be using that 2 times a day. Very, very effective antimicrobial. And then ProFresh.com is another company that that manufactures something like what you would see in the drugstore called Closis. So it's ProFresh, PROFRESH.com, and they sell a chlorine dioxide rinse, and you would rinse any of these rinses that you would want to get. You'd want to use for at least 1 minute twice a day, and these rinses are pH balanced. We want to avoid acidic rinses like Listerine, and I have nothing against that company, but some of the rinses are low pH, and so this gets a little bit deeper because we got to take into other health accounts before we start recommending what rinse to use. So we got to be a little bit careful. But the CTX4 rinse and the ProFresh rinse are safe for anybody.
Andrea Hardwick, should I be concerned about where my dentist saves the saliva suctioned out of patients? Or are there closed systems, and should it not concern the patients? What about dentists hopping back and forth between?
Yeah, the hopping back and forth between is a little bit of a concern because that's the nature of how we worked. We start doing restorative care in one room, and then we check a hygiene patient in another room, or we move between rooms. But we have an obligation now. We cannot enter a room with any kind of soiled PPE or contaminated PPE on. So that's why it's going to be a lot more for us. So the strategy of how we move through the office is going to change. That's our internal scheduling. So that's a big deal. And then the saliva, we shouldn't be concerned because it goes in usually through a separator. It usually goes out through the sewer system. And we know this virus is not going to, do well underwater, or, it's going to be pretty easily killed in those filtration systems. None of that is recirculated. That's all disposed of to the outside environment. The sewer system.
Dental offices are a challenge, but I don't think they're going to be a challenge for the sewer system. We're going to be getting much COVID from bathrooms.
Right.
Actually, we did get a challenge there. Joe actually set up a challenge with a new one, and my BJJ had already given us one. Thank you so much, BJJ. We really appreciate it. Yeah. And you too as well, Joe. K. King, I spray my mouth with food-grade hydrogen peroxide 3% before I brush my teeth. You can also add it to your water pick. Kills spirochetes and helps me keep the plaque down.
Happens to be correct. Yeah, peroxide, the only thing is hydrogen peroxide isn't as effective on all periodontal pathogens. So maybe in the spirochetal class, it works pretty well. We have some other things in there as well as viruses. And Ford, we do have some research that about the only thing that's been really researched against viruses is molecular iodine and sodium hypochlorite. And these are available. Again, that rinse sodium hypochlorite is available. So there's it's a great K King. It's a great idea, and it's way better than nothing. If you had high disease susceptibility, there's some other rinses you could use that might be more effective.
What's better than flossing? What's that thing? I think he was talking about my soft pick.
Yeah, soft pick if you don't have water. The water pick, the oral irrigation is much better if you have disease. But yeah, there's all kinds of proximal brushes and little things that go in between the teeth. And the reason why floss doesn't work quite so well is because it's straight. It's straight and the two surfaces are curved. So it only hits kind of a high point unless you really wrap it. I mean, you can get good with it and it works quite well, but it's great for healthy people.
So have you hit your thumbs up today, giving us a positive comment? Thank you, Little Viking Coach. I appreciate that. And I would say, yes, please do that. That makes a big difference. Speaking of mutual friends, look who's here.
Hi, Chris.
Do either of you have a preference for telehealth platforms? It's very interesting. I'll give you mine first. It's very interesting, given what I do. I started with telemedicine over a decade ago and was chief medical officer for MDLIVE, the #2 largest telemedicine group for years. And we had our own internal programs. Frankly, I didn't like them that much. Well, they were glitchy, just like most internal programs are. There have been, now these things are like, they're a commodity. There are so many different ones available. Here's what I end up using, though. I have ended up using GoToMeeting, Skype for Business, and Zoom. And most recently, more Zoom than anything else, because all three of those have given me the ability to look the patient face to face and understand when the patient starts getting bored or starts looking like confused. I know that I'm going the wrong direction and need to adjust. But I'm also able to show the actual the chart, the lab information, the results, things like that. Doug, what are you?
I would just say, Chris, the same thing. For the amount of options are just exploding, and I would first check with your software company, Chris. Chris is a fellow dentist, colleague of mine, and Chris, your software, whether it's EagleSoft or Dentrix, whatever your practice software is, will have a built-in platform. I'm using Revenue Well right now through EagleSoft, and there's a bunch of them, and so. You just find one that works well, but there's a lot of them.
Kay King, great show. Thank you very much, Kay King. I appreciate it. Hey, James Cantor, really good critical feedback. Carl and Aspen, if you guys could take a look at this, I think he's right. It is a little bit garish showing all of this stuff on both the top and the bottom. I think both of them are appropriate, but we probably need to do a little bit. I see you already responded. That was quick.
Well, I was going to say, James, I mean, that's something else, Ford.
They're really fast. We obviously need to do some of the banners, but to give it a little bit more of a rest in between, I think would be helpful. Thank you, Mr. Cannon. Chris Maestro, any feeling on using hypochlorous acid as an irrigant for use in the dental handpieces and or ultrasonics?
Yeah, no, I wouldn't do that. I would just use run water. I think that would be a hard thing to do. If we use just our water and our aerosol management chair side is going to be enough. I haven't, Chris, we can talk about that off air if you have a methodology of doing that, but that's through the bottles. We haven't thought about running HOCl through the bottles. But let me think a little bit more about it before I just, let's talk about that because that's a little bit complicated.
Thanks again, Joe. Joe jumped in there again and challenged others. I do appreciate it, and he made a good point. I think this is going to be a highly viewed episode. Again, very, very helpful information, Doug. As usual, I appreciate you coming on and sharing that with our folks. People just don't get this kind of information from their dentists.
Oh, thank you.
Sax girl, horn boy. Any thoughts about how to play woodwinds and brass instruments safely in ensembles? But before you start, I've got to tell some of my own story. I started off playing saxophone in my junior high band, and we were not that wealthy, and our horn was a hand-me-down horn. It was really bad, so they decided to give me a school horn. It was a bassoon. That was even worse. But I went nuts. One of my summers in school, practiced like 8 hours a day all summer, and ended up on Allstate. So I know a little bit about woodwinds, sax girl, horn boy, and you bring up a good point. I clearly would not share an instrument, but again, I think one of your real questions is that you're really blasting air through there and out that horn. Doug, any comments about that?
What a great point. I didn't even think about it. I never thought about it, but now that my son and daughter both played instruments in high school, and when I think about the saliva and the liquid that they dump out of their trumpet and out of their, out of the instrument, no question, this is a consideration. I don't have a good answer for this, other than maybe a pre-rinse every 30 minutes while you're playing an instrument might keep it safe. You know how we do a pre-rinse in the office? It will cut down maybe on the aerosol, but remember, this is a respiratory tract issue. And so if it's coming from the lungs or from the nasopharynx, you're not going to rinse those areas. So I don't know. I think this would be a risky place too.
Jan H, chlorhexidine as a possible pre-rinse, would that reduce COVID-19 virions? Yeah,
and Jan H, chlorhexidine does. There is some science there with chlorhexidine. That's our old standby. However, due to the acidity, some allergic reactions, there's for a lot of reasons, chlorhexidine isn't our favored rinse anymore. We have rinses that are more potent than that. And again, I would remind you, it's 0.2% sodium hypochlorite. That's the CTX4 from the Carry Free company, carryfree.com. And then our ProFresh is chlorine dioxide, and then molecular iodine. And that's available through the IoTech, IoTech Corporation. You get ready to use molecular iodine. So a lot better than that.
So Little Viking Coach says, close your eyes, James, and you won't even notice it. You'll also get the added benefit of not having to look at a couple of ugly guys.
I do like how responsive you are, Ford, and how, you know, when you're going through this chat here, you not only show the comments that are positive, but when there's constructive feedback, that's admirable.
Thank you. I appreciate that. Claudette P., this is a good one for you. When do you think we can start using the ultrasonic scalers again?
Claudette, if you came into my office on Wednesday and you did a test on Monday and you were COVID-free, I'd use the ultrasonic on you now. I'd use that for you now. I'd feel that comfortable. I think as our aerosol management chair side increases, we'll be getting right back to it. We're going to have chair side aerosol management systems that really suck away. It's literally going to be like taking your central vacuum and holding it near your face. And we'll be very comfortable again, and it won't be long. We need those instruments. Those instruments help us a lot.
Thank you as well, James, for the feedback and the comments. Joe Riley, by the way, I think Joe was I think you were a professional trombonist with the Army, weren't you, Joe? Brent Robinson, good. Hi, Doug. What would you say to patients who are fearful of going to the dentist due to possible contraction of the virus due to cross-contamination?
Yeah, Brent, I think it's a great question, and I would recommend the patients call your dentist office and ask them what they're doing and how they're, how they feel, how they're, what precautions are they taking, and we tried to provide a lot of different avenues of different layers of infection control. But here's what I will say: this is important, and this is important for everybody. I don't care what we do in our practices; you cannot eliminate the risk. You can't eliminate the risk at the grocery store. You can't eliminate the risk at the gym. You can't eliminate the risk. All you can do is mitigate the risk. And for some of us, we're taking tons of precautions and spending thousands of dollars to ensure our office has as little risk as possible. So reassure your patient, and then maybe if you have a very apprehensive patient, create a special time for them, give them a little bit of special attention. And do what you can to make them feel comfortable. That's going to be important.
So last one, and we're going to hang it up. I've been trying to get these, as you know, Doug, to more like half an hour, but given the content that you've shared with us today and the information that these folks were asking, I felt like again, it was clearly worth. And the other thing we're doing is Carl is slicing off the program pieces on a lot of these now and making it available a little bit later, so somebody comes in, they don't have to look at, I've got to invest over an hour. They can just invest 15 to 20 minutes.
Sure.
So Joseph Page, for months I've been using the iPad mini to watch. Haven't been able to find the dollar icon near the smiley face to donate. Oh, that's bad news. Can your tech person help, or is it just not visible? I don't know the answer to that, Joseph, but Carl, if we could just let them know at one of the next videos, I would greatly appreciate it. Joe Riley says, Joe is a big iPad guy. Joe says, Joseph, hit the live chat button next to the share button. So hopefully that helps. Thank you guys very much. And thank you, Doug, for sharing.
Thanks so much for having me. I appreciate it.
Talk to you guys later.
Bye now.